Okay, everyone, thank you for joining us. We're going to get started here, and if people are joining us afterwards, then they'll hopefully catch up. I want to thank everyone for joining this webinar, which is hosted by the Munk School of Global Affairs and Public Policy and its Innovation Policy Lab. My name is Jennifer Pagliaro. I'm a City Hall reporter at the Toronto Star, and thanks very much to the Munk School for having me here to moderate this debate. Today, we're going to talk about the world after COVID-19, and I know it kind of feels like we're in the middle of this storm, but I think it's really important to look forward and talk about where we're going in the future, and so I'm really glad that we're able to do this today. These are really big issues, and we only really have an hour, so we're going to jump right into it. First of all, it's really important to know that we are inviting questions from the audience. And there's a few ways that you're able to do this. There's a built-in feature on this Zoom call, so you can submit your question there. You can tweet at hashtag Munk Talks, or you can email Munk School directly, and they'll get those questions to me, and we'll get to those in short order. So now I'd like to introduce you to all of our panelists, and we have a great crew here. So we have Anita McGahan. She's a university professor and George E. Connell Chair in Organizations and Society at the Rotman School of Management and Munk School of Global Affairs and Public Policy. Hi, Anita.
Thanks for having me.
We also have Shauna Brail, Director and Associate Professor at the Urban Studies Program and Associate Chair, Partnerships and Outreach at School of Cities at the University of Toronto. Hey, Shauna.
Hi, Jennifer.
And we have Tara Vinodrai. She's an associate professor at the University of Toronto, Mississauga, and director of Master of Urban Innovation. Hi, Tara.
Hi there.
And last but not least, we have Shiri Breznitz. She's an associate professor at the Munk School of Global Affairs and Public Policy. Hi, Shiri. So all four of today's panelists are part of the Munk School's Innovation Policy Lab, which is hosting us here, and we're going to get started. I really want to start by really orienting people. I know that a lot of this has been so disorienting, and a lot of questions we've seen our politicians ask lately have been about when will the economy restart and when can I do things? Can I get a haircut next month? Will there be a patio season? Will my favorite restaurant survive these emergency measures? So Anita, I know you've been looking a lot at these questions. I wanted to start with you. Can you help us understand when we might get back to normal life?
Yeah, I mean, we're going to be dealing with this disease until we have a vaccine, Jennifer. So I think we have to think on the time frame of a year, 18 months of having to manage the relationship between the economic outcomes and the medical outcomes that we're all currently facing. And within that framework, you know, what we're looking for here are a couple of things as we reopen. We're looking, first of all, to reopen first in places that have the greatest economic impact, constructive economic impact, and the least chance of adverse medical impact. And in some cases, we're going to have to really push that boundary because of the strains, for example, that are on these frontline workers that have kept us all fed and taken care of over the last couple of months. So there has to be relief there, even though there may be some consequences medically, because it's simply unfair and untenable, and you know it can't continue here. And there's going to be a lot of learning that we do over the next, especially the next couple of months, as we reopen and figure out how to keep ourselves as safe as possible. And so a measured reopening will occur. Now, let me answer your specific questions here about things like haircuts and patio, and you know how long we'll be able to keep our restaurants operating the way that they are. So it's a little counterintuitive, but retail, including hairdressers and restaurants, it's really going to depend on whether or not these restaurants can keep social distancing practices in place. They can keep us 6 feet apart, whether or not, you know, there are protocols that they can use to get us the best of a retail experience, like exposure to stuff we're thinking about buying, and then perhaps complement that with online purchasing or takeaway from the restaurant, you know, whenever possible, to try to keep us as safe as possible. Haircuts are really complicated. There's no way you can stay 6 feet away from someone who's cutting your hair. I think we're going to see some restoration of businesses that are sole-owned proprietorships because of the economic impact for the proprietor of starting to reopen. But it's really going to, people are going to have to sort through their willingness to take the risk of exposure. I'm someone who, as you could probably tell, is willing to tolerate, a poor haircut for relatively long because I'm older and I don't want those medical risks. So, people are going to have to manage those kinds of trade-offs. Now, after a vaccine comes, we have a whole different set of challenges that we're going to face.
Right, and we'll get to some of those. Shiri, I know we have a lot of students, professors, researchers, I think, on this call, and there's a lot of questions about what this all means for universities in this reopening. Do you think there will be a fall semester?
There will be a fall semester. The question is, in what capacity and in how many institutions? Because all around the world, we already are seeing some institutions announcing they're closing down, which is unfortunate, especially in more remote areas. We also are seeing some of our more prominent universities, like Johns Hopkins, announcing that they are cutting in payroll, in pensions. So there's a huge discussion on what's possible. Now, even if all universities are able to move to online learning, not all students are interested in online learning. That's not the experience they want. So many of them have deferred, which means that this is a burden, financial burdens for universities. But also, a lot of students don't have access to online learning. We assume everybody has internet or very good internet to sit in all-day meetings. I'm not talking about, the mental impact on being on Zoom meetings day long, but I think fall semester will happen. There's a lot of options. Some universities are discussing leaving the large classrooms on online learning and trying to move the smaller classroom to, in-person learning. I think a lot of it will have to do with, as Anita said, the level of infection, the level of testing, where we are in all of this. But I know, for us at U of T, we are preparing for the fall semester. So universities that are able to will be ready.
Right, so it might be different, but people will still be able to hopefully pursue that education that they signed up for. And Shauna, I wanted to go to you now. As we start to reopen a lot of these businesses, or as people maybe start to return to school, there's a lot of questions about whether we're able to move around and keep this distance. And I wonder what you've been thinking about when it comes to cities and whether governments need to rethink transportation or street design as we take part in this new reality. Oh, Shauna, I just need you to unmute yourself first and start over. Thanks so much.
Thank you. What I was going to say, or what I was saying, is that the city that we want to arrive at after lockdown, upon reopening, and when we get to some kind of recovery, is the city we need to start thinking about now. Maybe 6 months ago or 10 years ago would have been great, but we have this opportunity once again to really revisit and reimagine what's important for cities. And one of the things that coronavirus and the lockdown has laid bare is just how crucial mobility is, and how it connects to every other aspect of our lives, from health to community to employment to education to retail, restaurants, really, culture, everything. And so what we've seen on lockdown in particular is a dramatic reduction in car traffic, which is really significant because in so many cities, we've given over so much space to private automobiles in particular. And the other thing we've seen is dramatic reductions in public transit use, somewhere between 80 to 90%. And those are, of course, coupled with dramatic reductions in revenues being brought in from the sort of the fare booth. And so that's causing a really significant problem, and a huge part of, for instance, the city of Toronto's debt that is starting to really add up into, $1 billion and a half over the next 6 to 12 months. And so on the one hand, we have these huge challenges. On the other hand, we have an opportunity to think about how will we use our spaces differently? Can we give over more of the roads? Can we take them away from the private automobile? And can we make more space for bikes, for cyclists, for pedestrians? So if we know that we need to be keeping physical distance, one of the reasons why transit ridership has gone down, in addition to the fact that about half of the population who can is working from, or half of the people who work are working from home, is also because it's really, really difficult to physically distance on public transit. And so there have been in many cities increases in the number of cyclists. And so some cities in fact, many of which were already thinking about how to create more space and more infrastructure for these kinds of active transportation uses, like Paris and London, but other cities as well are starting to add sort of these pop-up bike lanes and pedestrian zones on a short-term basis. But now we have cities like Milan saying we're going to, we're going to make these permanent. So it is a chance to expedite some of these changes. But we also have some really tough questions ahead. Things around, how do our mobility choices affect climate change and the climate crisis? And if what we have in cities around the world looks the same as what we've seen so far in Chinese cities, what we're seeing is many more people going to private automobiles. And in fact, intention in purchasing private automobiles going up significantly. So we need to be thinking about the interconnections between mobility and our city overall, but also between issues around equity, climate change, resilience. How do we build mobility features into the city that actually give us not just the what we need for now, but what we need going into the future?
That's really interesting. I didn't know that there was a move towards private vehicle. I think we can come back to this too. I want to talk a little bit more about transportation and work in a little bit. But first I want to go to Tara. When it comes to all of this rebuilding, I'm wondering if there are major companies that we're going to see that will actually fold completely. I know that you've looked at the example of BlackBerry and the kind of innovation that actually came out of its collapse. And I wonder if you can give us maybe a little bit of hope. Is there perhaps a silver lining to some of the economic challenges that will come?
Right, and in the case of BlackBerry, there's a big hope that when workers were laid off there, that they would start up their own firms. And in fact, myself and my colleagues didn't find that. What we found is that enabled a whole series of other startups to take on that talent and generate growth for a large number of smaller companies. So you could imagine that happening again, but there's a big it depends in that. And I've looked at a number of different industries where they've gone through a downturn and then a recovery, design and manufacturing. And so it depends on the type of workers and whether those workers will match existing or growing opportunities in the local labor market. And that really is going to be the rub of it all there. And I think there's another question there about the quality of the innovation system itself, whether there are strong universities, whether there are really good supporting actors that can help match workers who might be losing their jobs to new opportunities or to new firms. And there, that sort of the local and regional responses might be quite different across the country and in other places as well. And I think that's one of the things we'll really have to pay attention to, and whether those organizations will help take these sort of, the immediate responses by businesses and turn those into long-term recovery prospects for places and the people inside of them.
And Shauna, there's an interesting thing happening actually right outside my window. I've been watching this condo go up that was already under construction. And I know that a lot of us in isolation are still watching our cities build and grow. And I wonder, this plan that we've had to intensify parts of the GTA, do you see that changing at all? How densely we will be living together in major cities?
I don't think we've written the final word on this yet by any means, and certainly crisis after crisis has seen calls from people who say this is the end of cities, this is the death of the sort of dense, compact urban form that so many people and places really aspire to for lots of reasons. We know that some early studies of coronavirus and the spread of transmission has actually demonstrated, a study out of the University of Chicago demonstrated that it was these largest, densest cities that actually had the greatest spread, that the more contacts one has in their daily life, the greater the chance is for spread. And so density and coronavirus aren't particularly friends. They don't go well together if you want to protect people's health and people's lives. So on the one hand, absolutely, it looks like, at least in the short and midterm, density is going to take a real knocking. You know, if we're looking, I've heard estimates at universities talking about how much space they can use, what the capacity is, and it's something like 25 to 35% of space. And if we apply that measure across the city and we say we have to reduce, you know, use of space by 25, 35%, sorry, by 65%, that's a huge, or 75% even, that's a really big problem. So in the short term, absolutely, density is a difficulty. In the long term, I don't want to believe that we won't be able to go back to some kind of world in which we can gather, in which we can be close to people, in which we can exchange ideas and consume culture and have, you know, parades and protests in a way that is much more physically close than what we can do right now. But I do think in the short term, it's going to be a real struggle unless we start to design far more personal spaces, whether they're dense or not dense, in which, you know, we each have our own 6-foot perimeter kind of box. But, you know, within the condo building, what do you do in the elevator? Do you know, is the elevator large enough? You know, an elevator that had a capacity for 24 people, does it now take 4 people or 6 people? And how do you monitor that? And then how much time does it take to go up and down? Is it even worth the time? So that it is a problem. It is a challenge, and that is why we need a vaccine rather than just to be able to physically distance. You know, if we think about a future in which physical distancing is a requirement for decades, that's a much different future than if we think it's a future for a next, you know, 12 months or 18 months.
Mm-hmm. And Anita, I wanted to ask about density in the workplace. I know that there's been a trend towards building offices with smaller footprints. I know a lot of major companies are doing hoteling of workstations now, where you don't have your own personal space. And in the short term, a lot of those things seem sort of counterintuitive to this physical distancing we're doing. So what do you think that will look like?
You know, there's going to be enormous innovation and change, even in the short run, as we go back to work, to keep us 6 feet apart and to really think about how to keep us safe, making sure people can wash their hands sufficiently and so on, whether it's worth it to have people together to be able to overcome this trade-off between economic and medical outcomes here. We have to have people back to work. There's a couple of things, though, that I want to say, inspired by the remarks of my friends and colleagues from the Innovation Policy Lab. One of them is that this is going to be a tremendous period of innovation. We know, just picking up on some of the things that Shauna was just saying, we know that elder care has to change. And a lot of these changes are overdue. It's the same innovation agenda that we had prior to COVID, but we have this kind of, you know, it's not going to cut it anymore to object that this is too inconvenient or too costly. It's a time of tremendously compelling change, you know, and you know, thinking about the way we live in community with our elders differently and how our spaces are going to have to change to deal with that is a project that has to begin right away. We've talked a little bit about manufacturing, just to amplify that. This morning's news was full of stories of some marginally profitable or stressed manufacturers that have already made the decision not to go back live after COVID. They were on the edge previously, and this has just put them over that edge. Lennox China is now closing a factory in North Carolina. There was in Michigan a story about a Michigan maple board, like a kitchen board outfit that's shutting down. And I think that's going to be true of universities also, as Shiri said. These are all workplaces as well as, you know, we're going to have a permanent reduction, I think semi-permanent reduction or change, fundamental change in consumer spending. So we know that many of us have taken a look at our budgets and realized we were spending money on stuff that just wasn't important to us pre-COVID. There's going to be a permanent change in the way that we even spend money, which is going to ripple all the way back through workplaces and supply chains and so on. So lots of change right away and lots of scope for innovation to implement, new AI, new analytics, and it's going to raise all sorts of questions about privacy, about surveillance. Many employers are going to be asked to do health screening and testing, and that is going to expose. I'm not sure I want my employer to know, my pre-existing conditions. I'm not sure if I'm a vulnerable person. Let's say I'm HIV positive. I don't know that I want my employer to have access to my health data and to be making decisions about which team I'm going to be on, an A team or a B team, based on those kinds of characteristics. And in fact, at the IPL, we're pulling together a number of policy options briefs that talk about these kinds of issues. How do we have a public conversation about surveillance and privacy? How do we think about who's responsible? The government can't easily implement contact tracing. Well, is it fair for an employer to be asked to do that? How do we implement these kinds of systems? So a lot of this work is yet to be done.
Right. I wanted to ask Tara, it sounds like we're going to have to be making a lot of changes, at least in the short term, based on everything that Shauna and Anita are telling us, and Shiri about universities. And I wonder what the innovation sector can offer governments and cities and just everyday people about kind of adapting and turning on a dime, because it seems like it's going to be really jarring for a lot of people.
Right. I kind of want to link these comments to something that Anita was talking about around manufacturing, and Shauna's written about this as well. And I think that there's a sector where we've already seen some immediate responses by firms, pivoting from, in the case of distilleries, towards hand sanitizer. Will they continue to do that for some time? Perhaps maybe they'll just turn back to what they've been doing previously. But there are these windows of opportunity for those kinds of firms to innovate and introduce new product lines, diversify, which may hold on to that employment. And that's an important question for the people who are losing jobs through this process. And some of those are in very vulnerable sectors already, particularly in North America, like manufacturing. So I think there's questions like that. There are a number of companies where they have pivoted towards making personal protective equipment, which, I think there'll be a continued demand for some time, that sort of vaccine question. And relatedly, even if there's a vaccine that's found, we have to think about how the production of that vaccine is going to happen. And there's innovation and medical related, life science related capacity is very uneven, right? Firms that have been able to do that already may continue to do so, but we have to think about the volumes at which we would actually need the kind of equipment to deliver vaccines, the injectable plastic molding related to the parts to deliver that to humans, the actual making of a vaccine itself at high levels. And I think there's a large number of questions that really link to that, and we sort of see opportunities for innovation in manufacturing, particularly in places that could shore it up, that could really generate opportunities for people who are being left out in the innovation economy more broadly. So I think there's one set of questions there that are really important to pay attention to. And I think, again, is that sort of the pivoting questions. And I actually have my second example is about manufacturing again, a startup company in Waterloo that is able to link together a sort of a craft maker community with a need to create personal protective equipment rather quickly. And they worked very closely with frontline workers to work on the design, to perfect it. But they needed institutional support to to scale up to a large volume very quickly, and also to connect to regulators to make sure that the equipment they were making would be in fact useful and acceptable in a healthcare setting. So there are these kinds of things, and there are organizations that already do that. And if those aren't in place, and in a number of places they aren't in place already, or are not effective, then I think we'll see a very uneven landscape when it comes to recovery from that perspective. So.
Right, that makes sense. And Shiri, I wanted to go to you again, with the travel restrictions that are currently in place and without knowing what that will look like in the future, I know that there's a lot of universities, University of Toronto included, that rely on international students, not only as part of the community, but as part of the way that the university funds itself. And so I wonder what challenges universities might have in the future, even in this upcoming semester, with if there are still restrictions in place.
So, according to the Pew Center, 90% of the world is under travel restrictions, right? So we, until that changes, we need to assume that most people will not be able to travel, right? So for those, in that perspective, universities do have a huge problem. And that this is not unique for Canada. This is all around the world. In general, in the last 2 decades, universities' budgets have been cut, and international students have become part of the budget. In some of them, up to 30%, even 40% of the budget. Right? So it's a huge impact on universities, and that's part of the question of a decision on how they're going to open the semester and how they are going to accommodate. Now, it's easy for us to say, we're just going to go to online learning, right? But most universities don't have that equipment within the classrooms. So even if we assume that each professor can have a laptop in their room to do a Zoom meeting, right? That doesn't really answer when you have 700 students lecture, right? Or people logging in from all around the world. This is difficult, and similar to manufacturers, we're asking them now to retrofit each and every classroom to fit this kind of learning. And you have universities that have been doing this for a long time, so they are probably more prepared than others. But even if we look at our own school, all of our classrooms are fitted for online learning. So you have that issue, and then if you are an international student, you're going to make a decision. Do I want to? Is this the kind of learning that I want? Right? Because international students are not, from what we know from studies of international students, it's not just about going abroad, right? It's not just about experience. It's picking, they have the ability to pick where they want to learn, very specific kind of education. So if we are not able to provide that education, we have a problem with recruiting these kinds of students. So that's on the student side, but in the institution, a lot of the regular solutions that universities have been dealing with. So, if you look at the 2008 crisis, we had three main solutions that university did. One is we are not necessarily be able to do now, right? This is not the time to raise tuition. So take that off the list. You increase the number of international students, so we are not able to do that. And last, universities are using a lot of work with industry to supplement, and industry is now challenged as well after COVID. So we have these traditional channels that we are not able to use. So this is the place where we need to say to the government, federal, provincial, in the US states, this is where you need to support, because universities are not just about education or research, that things we tend to talk about regularly. Shauna and I have been written extensively on the fact that it's the engagement part of the university that is important. Universities are part of communities, and they contribute in so many other ways through volunteer work, engagement in policy, within schools. So you take universities out of the equation, the impact is more than we're losing this brick and mortar or impact on the labor market. This is a pillar of society that it's very important for us, and we should make sure that we take care of these institutions.
I think that leads us into our first audience questions, and thanks for everyone that's submitting. You can still submit it. I'm getting your questions. More about how international students should be preparing for this upcoming semester, what they should be doing in advance of the fall semester, including when might be a good time to apply for a visa. One person wants to know, or whether they should wait for further instructions about whether classes can be online.
So this is, it feels unfair, right? I'm thinking of our graduating class this year, same thing, and graduating high school students. You are in, and we are all in uncharted territory. And it's a question of whether you can wait, first of all. So it's a personal decision first, whether you can wait, with the career and the steps you want to take in life. Because I think a lot of universities are going to come towards students in requirements, in deliverables. So it actually might become a very interesting year to be part of. So I wouldn't shuck it off and say, okay, I'm deferring and I'm going to do it next year. But I will consider which classes I'm taking, for sure. Things that I think are much more manageable than, some more applied on classes that, for sure will be hard to do online. So I think the choice of what I'm studying, and then there's the personal choice of, can I wait another year? And does the university promise me a space next year? Because, at one point they won't be able to offer spaces for everybody next year.
And we have another question, and I think if any of you want to go first on this, I think it touches on a lot of what each of you has spoken to, is just what kinds of policies or measures could be put in place in order to prevent another virus like coronavirus from emerging. It's a big question. Maybe Anita, you can go first.
Thanks for the question. So just a couple of ideas to start the conversation that I'm really interested in what my colleagues have to say also. So I think we need to strengthen global healthcare institutions, including the World Health Organization, so that we have as robust an international and global system for healthcare as we do, for example, for financial services. And for finance. So as you know, of course, in international finance, there are systems of institutions that link federal banks like the Bank of Canada and the Federal Reserve Bank in the United States and the Bank of China and so on, for harmonization of decisions about interest rates, for exchange of information. There's of course, global institutions such as the World Bank, the International Monetary Fund, and various UN agencies. And then there's also a newly created in 2009 a financial stability board that was set up to make sure that the financial that there's deep financial strength within countries that and coordination across countries in the redeployment of resources. We need analogous institutions in healthcare. It's kind of crazy that the governor of Massachusetts had to get the Patriots airplane to fly to China to bring back N95 masks for Massachusetts General Hospital and other hospitals. That kind of coordination should not be ad hoc in the middle of a pandemic. It needs to be developed in advance, and it actually will increase the capacity of healthcare systems in the very first place to have that kind of coordination. We also know that a lot of innovation in healthcare has been wildly overdue and has been stalled by concerns about health quality, including, for example, telemedicine. There's been kind of this sort of resistance to change associated with analytics and digital technologies that just isn't going to cut it anymore. We know that the health outcomes that we can achieve through telemedicine are often as effective for in-person treatment, especially for diagnosis or early diagnosis of health conditions. So, like most industries, we're going to have a lot more deep localization of physical capabilities for physical interventions. And we also are going to have a lot more virtual global innovation that is going to need to be managed and envisioned and supported institutionally. And that's a big project. That's going to take it's going to take some conversations and some work to get that sorted out.
I want to add to what Anita said, and go back. We had our first IPL Munk panel on global production chains. Shauna was on that one, and the discussion was on the fact that we need to think about these global production chains, and we need to think where we're manufacturing, right? And we need to be able to keep some capability within our home states, right? Because when time like this happens, we are left without any control over some of the most basic ingredients and products that we need. And similar, I think, in ways to agriculture, where we fund to agriculture in the country in order to make sure that we have basic supply. We need to treat that as well in a similar way. We think to the future and on manufacturing vaccines, as Tara said, right? This is important. It's something that we need to make sure we are able to do it here and not wait until some other country finished supplying their own, and then they maybe will transfer some to us, right? So this is something that has to be on the first priority of our policymakers.
And can I just add that that's so important because we're going to need to have a fair allocation of vaccines across countries also as soon as they become available.
Mm-hmm. I would just add to the comments that have already been made that particularly on the city side, that we tend to underestimate the impacts until they show up on our doorstep, right? So we saw what happened in China, in Chinese cities. We read about the lockdowns. We said, well, first of all, we live in a democracy. This will affect us differently. We can't do that in our own cities. And this is somewhere else. And until it showed up on our doorstep, the reality of it seemed far too distant, despite how global and interconnected our world is. And I also think we tend to anticipate incorrectly, so that if going forward we say, how do we prevent coronavirus from happening again, we're not necessarily going to be looking at all of the right things, because if coronavirus happens again, we may very well be prepared based on these experiences, just like if SARS happened again, we might very well be prepared based on the learning from SARS. But when the next thing happens again, how do we prepare for that? And I think that is a problem and a challenge for cities, because as John Lawrence, who's an urban affairs journalist, pointed out very shortly after we began this shutting down of cities and institutions, was that in fact the city has just gone through a 2-year process of developing a resilience plan, and nowhere in that plan did it say the word pandemic. And so perhaps we're very busy planning for the thing we see in the rear view mirror, but we actually need to be able to figure out how to look back to learn from the past, but also to match that with what's happening ahead. And the last thing I would say is that there is a political challenge here. That when we talk about elections every 4 years at the municipal level, at the city level, what do you need to do to be reelected? You need to provide really short-term opportunity, incentive, activity, ideas, change. But when we're talking about, thinking about the future, how do we bake that in to rewarding the political process for planning for the long term, and for investing in the long term, and for innovating in that direction as well?
And I think what I would add is that in all of this, and I think Anita pointed to this as well, is talking about the distribution of vaccines and the sort of equity. I think there's a large equity component that has to be thought through in all of this, both the sort of on the inclusion side and the equity side, spatially, meaning that small communities and large communities are all going to, end up in a place that's stronger and more prepared, but similarly within. And we've seen it particularly in this pandemic, we've seen that the effects have been felt very unevenly. Not noticeably, I think that women have held the brunt of the responsibility because of questions around childcare, but also because of the types of work that have been affected. So there's sort of questions around gender inclusion, but there's also broader questions of equity that really need to be thought about as we sort of plan for future events, right? And they may not be, per Shauna's comments, they may not be coronavirus. They might be quite different, and having that slack in capacity to handle that and hold in place those sort of questions about how are we going to make sure that everyone fares okay at the end of the day.
So we have lots of questions coming in. I'm going to try to get to as many as possible in the time we have. There's a few about transportation, and Shauna, I wonder if you could tackle this. The first is about how transit agencies can be sustainable going forward, given that traveling, solo in your car is what's being recommended, or walking or cycling alone. And there's another question, which I think fits into this, about how cities are reducing services by route frequency, and how do they decide which routes are essential and which get cut?
Sure. So in terms of the transit agency piece, this is a really devastating sort of knock-on effect of the lockdown and even of the reopening and the recovery, because of the basis on which public transportation is built is focused on and emphasizes density and gathering, and you know, the greater the use of transit, the greater the success of that transit. And yet now we're at a time, and again, in the short term, we simply can't have that and maintain health. I saw some images today from London, England, where the Prime Minister had encouraged people who could go to work to return to work, and there is no distancing taking place on their transit. And you know, the real fear is that this will result in elevated transmission, not in any kind of a acceptable recovery. And so what can transit agencies do? First of all, we need to remember that in most places, including across Canada, public transit is subsidized publicly by governments, both at the sort of at the level of building of the infrastructure, but also on the operations side. And in order for public transit to keep running, we're going to have to, as a society, say, we need this service. This service provides a series of opportunities, both in terms of addressing equity and access, but also in terms of addressing goals related to reducing emissions, and in terms of creating the opportunity for a vibrant, thriving spaces, because it has the ability to bring many more people to an individual place, and to sort of reduce congestion as a result. So we're going to see continuing subsidy and increased levels of subsidy. It's going to be very difficult to cover the costs of maintaining these services, and that's why we see transit agencies, not just in Toronto and across Canada, but elsewhere as well, starting to cut service to focus on those most important, those most significant routes. And what are the things you look at when you're cutting service? You look at the use of those, you know, at the frequencies, but you also look at who's using it, right? And are there alternatives? You know, we've started in the last 10 years to see a lot of innovation in mobility in general, right? So the advent of ride hailing. And by the way, I gave those numbers in China about the sort of the return to different kinds of mobility. Ride hailing and taxi use is also down because, again, it's not a private use. But we start to be able to think about, you know, can we serve different densities and different kinds of uses with smaller vehicles? And so now we have to think about, can we serve those areas with smaller vehicles and maintain the distance there? I think it's really tricky. It's a really sort of sad side effect if we reduce the ability to create access to the city and to places, and also to be able to address a number of other goals that in particular public transit does. At the same time, we can start to see encouragement and connection of transit agencies with cycling, particularly with bike sharing. So in some cities there have been, you know, bike sharing has been made free or connected to the transit service. And for trips of, you know, 3 to 5 kilometers, which are about 50% of trips in the biggest cities, but don't necessarily solve our challenges in the suburban and the exurban areas of cities, we might see a move of transit agencies to providing and supplying other means of moving around, other than the sort of traditional transit vehicle.
Tara, there's a question here, I think I'm going to direct to you. Someone asks, how will the massive debt that we are accumulating right now affect innovation and important infrastructure changes? It's a big one.
No, that is a big one. I don't think I can, you know, I'm not a public finance person, so I think that's the sort of, you know, I would put that out there to begin with. I think there is a big question about how debt will be, you know, how the burden of debt will be felt. And obviously there's, you know, right across levels of different levels of government, personally and businesses, everyone's accumulating or seems to be accumulating a large amount of debt as we sort of try to spend to support, to bail out various, you know, various organizations, various sectors, various people who have been left out of work, right? So I don't think I can take the debt question head on, but what I can say is that there really are going to have to think a lot about innovation and what that means. And it could be policy innovation, it could be innovation in the workplace, how we organize work, how we stagger work is certainly in the short term. But another real pressing question I've been thinking about around the innovation piece is that we've, historically always thought it's very important to have, networks of people who are connected to, to flush in new ideas. And that becomes a lot trickier. We've usually said we have to be face-to-face to interact, both sort of informally and formally. And so some of these short-term things around thinking about, can we displace people and have them work from home to alleviate, pressures on transit, or how do we arrange this in different ways that might allow for some forms of equity, we might actually begin to undermine in the longer run some of the innovation capacity. So I think it's sort of really thinking through how we're going to support innovation differently to allow for the exchange of ideas that is sometimes tricky, and even in these kinds of formats, virtual formats, we're really going to have to think a lot about that. And I'm not sure that that connects to the debt piece, but again, I do think we need to think very carefully about how innovation happens and the various contexts in which it happens. For sure. So we have so many questions coming in, I think from students, and I just want to acknowledge that there's a lot of you, and I'm seeing them. Shiri, there's a question about student living, and especially in and around campus, and how universities are dealing with that. Kind of going back to the density question, we have a lot of students that live together in the same buildings or the same rooms.
So I unfortunately have no information on that. I think Shauna probably know a little bit more on that, but I think this is a decision that the university is going through now. Which we have actually a few students that had to stay back in the student housing on campus, and so the university has accommodated them. But I don't know specifically on measurements regarding the housing.
Okay.
I would just add in that actually at U of T, there were several thousand international students who remained in Canada and who remain in residence. I also have two children, one of whom just finished first year university and one of whom is entering first year university next year. And so the one who is going into second year has rented a house with 6 friends, 5, too many friends as far as I'm concerned, to live in one house. But anyways, they're able to physically distance in that house. And she has every intention, despite the fact that McGill announced this morning that their students should be planning for a remote term predominantly. She also sent a note that she's going to go live in her house. My son is about to enter first year engineering. He knows that he'll be able to go to start university, but he also knows that he very well might still be in his bedroom here and not in a room in residence at a university.
Right. Now a fun, but I think still a very important question. Someone asked about dating in the time of COVID and even post-COVID, and how that will work. We've seen so many different processes shift online, but obviously the way that we're interacting and that personal connection that we're having is also just as important to people. So this is for any of you.
I think this is a time when we're person-to-person contact outside your immediate family unit, such as Shauna's children are pursuing, as they think about going to college and going and so on. It carries with it different responsibilities now than it did previously. And whether it's dating or whether it's, friends getting together, or whether you have to make good choices here that are going to have consequences for, a lot of people. Anybody that you interact with is going to be made vulnerable by a poor choice that you might make in any particular moment. And, it's a time when all of us have to think about, what's important to us. How do we really make good choices there? Certainly, I was listening yesterday to some colleagues at universities who are wrestling with exactly these questions that we've been discussing, talking about, whenever there's alcohol in their students, there isn't social distancing, was basically the argument. That's going to lead to tragedy. That reality. And so there's a level of I think a weight, a level of consequence, a level of responsibility that's going to be foisted on students such as Shauna's children that previous generations haven't had to consider, and that's going to be really consequential. And can I just also add that that's going to be amplified all the way up to the governmental level. As Canadians, we are going to have to decide, how do we want to interact with the rest of the world? Do we want to shut our borders? And we've done a fantastic job as Canadians of managing this crisis, especially relative to our neighbors to the south, in terms of being able to implement social distancing. Our governmental leaders have been very consistent and coordinated and have enforced the rules really in ways that have changed our culture compared to what's happening in the United States. And I say this as an American Canadian, as a dual citizen, who's had exposure in both environments, who's been in both environments. That Canadian identity is very important in the world. Are we going? Air Canada announced yesterday it's thinking about opening up international travel to vacation destinations. I think it's important that we have this conversation. Do we want to do that kind of travel, or do we want to stay closed to that kind of international exchange, especially given the subtleties that Tara was describing about low-income communities that benefit from Canadian travelers, and what are the inequities associated with shutting that down?
Right.
They're big questions.
Yeah. You've really taken dating to this bigger place, which I appreciate.
Well, I think maybe being the Innovation Policy Lab representatives here, this is time for new innovation in the world of dating, and new products and new ways to getting people together. Also applies for our businesses, restaurants. Can you create a safe environment for people to actually have dinner in your restaurants by keeping the distance, right? So I think this is not just, as Anita said, the personal decision, but this is also about what the environment is allowing us to. So yes, we should go and create some new products for us to be able to do some dating and more socializing in a distance.
Mm-hmm. I think interestingly, this conversation about dating brings up a lot of important points that apply elsewhere, right? It's really a time to make good choices, and those good choices can be very hard choices. They're not the choices you would want to make, they're the choices that you have to make. But I also think, and just like in all of the fields we've been discussing, and dating is no different. Universities, industries, work, cities, they've all actually demonstrated at this time of crisis in many places around the world, and I believe including in our own city and including across the country, the ability to be able to make pretty smart, rapid, creative choices and revisions or amendments to be able to sort out how do we move forward, at least even in the nearer term and in the midterm, even if we have no clue what the future really holds.
I would add one thing. I was thinking about the dating industry, and Shauna, I was thinking about your work on the new media industry back in the 90s, and some of the innovations that came out of applications in dating, in fact, spurned and provided sort of the technologies that are now being used rapidly in other industries, right? So perhaps, and this is, perhaps we should be looking at what happens in these specific industries as rooting and seeding, the next waves of innovation. And all the stuff online, the digital media stuff, a lot of that was rooted in relationship related activities.
Mm-hmm.
I want to try to sneak in one last question here. There's two questions that I think I can tie together, and I think it really is speaking to a lot of what we've been over, but about kind of each of us, what our responsibility is. One person asks how you anticipate our collective civics adjusting to this post-COVID environment, and which could be grounded, they say, in fear, and how our political leadership will address that kind of social civic anger, and also just what our collective civic responsibility is in all of this. What is the role for each of us going forward? maybe I'll start with Shauna this time.
Sure. I think that and Tara pointed this out in some of her earlier comments, that the role of associational action, whether that's, you know, formal organizations or informal community collectives, we've seen across the board sort of community grassroots organizing support, whether it's, you know, providing meals or shopping services for an elderly neighbor, whether it's helping healthcare workers. We've seen like a tremendous uprising of compassion at a very difficult time. And in fact, last week when we were discussing some concerns we had in the urban studies program, I sent a very quick email that says compassion is the new competition. And I think we've really moved there, and I think that's part of what we need to do as a civic society is to, you know, is to be able to really think about how do we treat people and how do we privilege people first, so that we can continue to sort of, you know, to do the right things for everyone, to create a better outcome in the end.
I think that remediating inequality, we have to, you know, this is the answer to your question for me anyway, of how do we prevent something like this from happening in the future, is we have to know that this crisis amplifies vulnerabilities, and we have to address that spot on, absolutely, as a core mission in any community.
Well, if there's no one else wanting to weigh in on this one, I just want to first of all thank all of you for being here. I'm sure I speak for everyone watching at home or from their socially distanced workspaces that this was a really great discussion and gave us a lot to think about going forward. And also thank you to the Munk School and the Innovation Lab for putting this on and for having me as your host. And thank you to everyone for your questions. I'm really sorry if I didn't get to all of them, but I hope that this touched on some of what you were hoping to hear today.
Thank you very much.
Thank you.
Thank you.